yeah.
All right. Well, if you feel like you need to interject to ask me a question or bring something to my attention, don't hesitate. Happy to
Okay.
whatever.
Thank you. Thank you.
Can you see my slides?
Mhm.
Okay.
Hello, everyone who's joining. We'll be starting in just a moment. We are very pleased that there are so many people interested in this seminar. So we just want to take a moment to admit as many people as we can before we get started. So it'll just be another moment or so here. And thank you for your patience with this admission process. We're keeping track of all the folks who are reaching out and participating so that we can kind of build a network here. So,
Yay.
yeah, we're really excited. This is the popular place to be, in case anyone's wondering.
This is where all the cool kids are hanging
This
out.
is where all the cool kids are, for sure.
Actually, all the nerds probably.
Yeah,
Even better.
yeah,
Okay, I'm gonna wait an extra minute and I'm gonna.
yeah. And then I think we'll wait one more minute, and then we can get started, and we'll just kind of
Yeah,
continue to watch and admit
absolutely.
people. Yeah.
Absolutely.
Why don't we go ahead and get started because it's a few minutes
Yeah,
after 12 and we want to be
sure.
respectful of everybody who was
Let's
able to
start.
get here.
Okay. Hi, everybody. Welcome back to the Autism and Adulthood Seminar Series. I'm Dr. Eleonora Paolizzi. I'm a postdoctoral fellow at the ECHO Autism Institute and Bancroft. It's wonderful to see many of you returning our first seminar, and I'm equally happy to welcome those of you who are joining us for the first time today. I'm delighted to be chairing this meeting today with Dr. Claire McGrath, Senior Clinical Director at Bancroft.
Thank you so much, Eleanor. Welcome, everyone. My name is, as you mentioned, is Dr. Claire McGrath, and I am delighted to be one of the chairs of this seminar series. This reflects an ongoing collaboration between the Drexel Autism Institute and Bancroft. We are focused on advancing the integration of world-class research and state-of-the-art clinical care and services to advance the quality of life and well-being for autistic individuals. AJDAI's public health approach fits perfectly with Bancroft's longstanding commitment to autistic children and adults. And we developed today's seminar series to focus on our attention on understanding the unique experiences of autistic individuals in young and older adulthood. As a reminder, today's session is being recorded and will be shared afterwards through the AJ Drexel Autism Institute's social channels. Please feel free to share your questions and comments through the chat during the seminar because we will have time for discussion at the end. And I would also like to ask everyone to mute your microphones while we're during the presentation.
Today, we are honored to welcome Judith Ursitti, co-founder and president of the Profound Autism Alliance. Judith is a nationally recognized advocate for the recognition and support of autistic individuals who require 24/7 care throughout their lives. She has been involved in shaping policies that improve access to services and in shaping national conversation around inclusion, equity, and dignity. Before we get started, I'm going to ask Dr. Elizabeth Sheridan, Clinical Director and Associate Clinical Professor at the Drexel Autism Institute at Drexel University, to welcome our distinguished speaker today.
Thank you so much, Dr. Palizzi. Can you hear me okay?
We can hear you perfectly.
Perfect. So I am honored to welcome Judith Ursitti today, and I have a formal introduction script I was supposed to read, but because Judith's a friend, I know she has her own, and a colleague, a very respected colleague, I know she has her own introduction, so I'm going to honor her and allow her to introduce herself, but I just want to say one quick thing of how grateful I am that not only did Judith she was willing to show up at the scheduled time last month when this was supposed to be, despite being physically injured. And I said to her as her friend, let's reschedule it because in this day and age, we need to ask for grace for lots of reasons. And I'm one of those people asking for grace lately. So I just wanted to say that and thank Judith for just empower people to ask for help like Judith did that day because I said, why don't we just reschedule this? And I also just want to acknowledge we did not realize in the hurry to reschedule it that this is a federal holiday. So thank you so much for folks who are joining us on a federal holiday where many of you may be off, and I want to honor that it is a holiday and that we're recording this. So hopefully many more people will watch this on demand. And my final thing before I hand it off to our dear colleague and friend is she asked that we actually keep the chat and Q&A open because that's who Judith is, because we understand that words matter and that you can say autistic, autism, or on the spectrum. You can say profound or autism with profound intellectual disabilities. That's what Judith is going to teach us today. And so I just ask that myself, Dr. Giacomo Vivanti, Dr. Paolizzi, and Dr. McGrath, who are a part of this seminar series, will be monitoring the chat. And I just ask that we have compassion and clarity in the questions and how we ask, even if you don't agree with certain words, which is okay, because Judith is the type of bridge builder and alliance builder that you're going to hear from shortly that encourages conversation. So without further ado, take it away, Judith.
Wonderful. Thank you so much. It is really a surprising honor to be included in these conversations. I always have things I want to share around my exposure to autism and some of the things I've learned through the years. And I'm always just surprised and honored when I'm invited to share those with other people. So thank you guys for showing up, especially due to reschedule. I actually tripped over my golden retriever at Jack's graduation party, my son Jack, who's autistic and just aged out of his programming, and I hit my face on the table. So it was not pretty there and it was hard to talk. So, but I'm all better now, thank goodness. Probably too much information. The Profound Autism Alliance, many of you have likely heard about it, but I want to be clear about who we are and what our intention is. We did start this around 3 years ago, and it's really just to kind of focus on people who are autistic, who have intellectual disability, possibly. And I want to footnote that by saying I see no shame in saying that someone has an intellectual disability or any sort of disability. I think it's just a form of neurodiversity that needs to be recognized. And we're really focusing on not elbowing out others, but in walking forward with others, focusing on the health and the connection of people with profound autism through what we call inclusive research and focused advocacy. And the whole goal, as I said, is not to elbow out others. It's not a competition, but it's all around meaningful supports and services. Our true vision is really just grounded in compassion for, first and foremost, autistic people in general, those who require lifetime 24/7 care. That's the group of folks that are really leading us. And then their caregivers, their providers, their community. We think that clarity is critical right now for everyone. And we think by focusing on compassion and clarity, we can affect progress, which we all need to improve health and connection. So that's what this is all about. This is not medical or legal advice. This is just me sharing some recent findings and some thoughts with all of you. And I hope we can have thoughtful discussion around it. Now, a little bit about me. I'm from Texas originally. I've lived in Boston for the last 20 years, which has been an experience. I love it. But I went from Austin to Boston, essentially. And this is just pretty much about me. Life is like a game of chess. I really don't know how to play chess. I'm still trying to figure it out. And I hope some of you can relate to that. I have a feeling. And then also, I felt like sharing this quote from one of my favorite Texans, Kinky Friedman, who ran for governor many years ago in Texas. He's a character, and he wrote The Guide to Texas Etiquette, which probably a lot of people need to reread right now. And it just reminds us that courtesy is owed, respect is earned, love is given. So For those of you who don't know me today, you do not owe me respect. You don't know me. I hope by the end of this conversation, I'll start to establish some respect with you. That's the goal. And for me, love is given. That sounds corny, but it's just true all the time. I think that kindness is a choice, and I think it's something in our community that I've had a really just privileged thing to observe. And just an example I wanted to put forth from the beginning was an experience I had at INSAR this last year, which was in Seattle. And there was a special interest group that met to discuss how to include people with profound autism in research. And we're going to talk a little bit more about that later. And I was the caregiver person sharing a caregiver experience. And then there were folks from Emory and from Marcus and from Yale, researchers who are really trying to be innovative to think, how can we do this? We've had lots of conversations about how we should, but this is all about how we could and how we do. So the room, I didn't know if anybody would come, but the room was packed. People were standing. And some of the younger researchers from Yale and from Emory, when we set out into groups to kind of talk and brainstorm about ways to do this, there was a group of autistic self-advocates in the room who were there and who were feeling concerned and who were feeling worried and who were feeling threatened. I think, many of us in the community walk around feeling threatened a lot by each other. And I think that's detrimental to all of us, to our well-being and our progress. But in this situation, the young researchers, they stepped outside with the autistic self-advocates, and they just had a respectful conversation about how we can work together on these things. And I think in that moment, the whole group, it was just kindness as a choice. I think it should be moving forward, if we can at all make it a minimum requirement in our engagement with each other. And this was just a beautiful example of that. There are possibilities like that happening in the world all the time. The unfortunate thing is that you don't see that online a lot. And I think a lot of us get just overwhelmed online. You read comments from people you've never met, and people go back and forth. And it's harmful, it's toxic. So I think moving forward, and again, you guys can think I'm just a total cornball, but I'm just going to say it. I would love to see us swinging into a new era. Taylor Swift has had all of her eras, and she's flying high, just like my son Jack, who's swinging in this beautiful picture of him. We've had incredible moments in our backyard on our swing set. I think it's time. I think it's time for a new era. I think it's time for us to come together. We're going to have differences. My husband and I have been married for, I think it's going on 27 years. And we made an agreement probably about a year ago that we're going to be in a new era. It's called the nice era, where we're going to just kind of move past the 25 plus years of arguing over how messy the closet is, or who unloaded the dishwasher, or who's doing what, or spending too much money, or whatever. And we're just going to focus on seeing each other, being kind to each other, because the time we have left together is precious and limited. And I think that applies to our community. There's a lot going on in the world. There's a lot of people moving against us in general. So we're going to have differences. We're going to see things differently. If we can find our commonalities and work on that courtesy and that respect, and even that, I'll dare say it, love for each other, I think we can make progress. And so I want to talk a little bit to you guys about that today. I know probably all of you are extremely familiar with the Diagnostic Statistic Manual of Mental Disorders and how it breaks up autism spectrum disorder currently. And it moves from level 1 all the way over to level 3. And it talks about varying support needs. These are real. You see them all in your research, in your practice, or if you're a caregiver or an autistic person in your lives. These are real, and they all deserve to be represented, supported, and helped in whatever way is needed. there's a lot of confusion in the world, even in the autism community, I would say too, about what autism represents, what it is, and then there's a lot of back and forth within the community, you all know, about how it should be represented. So there are really powerful people in the news like Greta Thunberg, and she talks about how under the right circumstances, being different is a superpower. And I would say, like this picture of Jack is kind of indicative of that too, just from a different place. Um, you have influencers. There was an influencer who was very popular a few years ago. She had millions of followers on Instagram and TikTok. Paige Lael, beautiful young woman, and she talked about how she was overly social and she gives way too much eye contact and she's really good in social situations. So externally, when the world sees those, they're like, oh, okay, autism is an identity. Like these people are celebrating that superpower, taking advantage of the strengths. But it's so important that we acknowledge the other components or the parts of the spectrum. And I think probably most people in this group do. I'll give an example of a friend of mine. Her name was Feda Amalidi, and her son Moo, who's pictured here. Moo loved to go to concerts. He loved Katy Perry. You can see he just exudes joy. And has a lot of presence and power in his own way. He was the type of person who was autistic and could not be left alone, required lifetime 24/7 care. And his mom, Feda, we did a lot of advocacy together through the years, and she was just hilarious, a powerhouse, just a world changer. 5 years ago in September, there was a fire in their home, and Moo was upstairs in his room, and Feda and her sister and her niece all escaped. But Moo did not leave his room. He was confused about what to do. Feda called, his family members called, they couldn't get him to come out. So Feda came back, went back inside the house, ran up to be with Moo. And Moo is super tall, a strong presence. And so Feda and Moo did not escape the fire. They were in the fire together and they were found in one another's arms. And so in that situation, I think the inability to comprehend how to navigate this horrific experience, really was overwhelming and it was tragic. And so there's stories like that too, that swirl around in our community. That one has caused a wonderful project to be created called the September 26 Project, which is all around safety plans for families who have autistic loved ones. So check that out if you have a chance. But there are different experiences. There's darkness, there's light. There are writings about weaponized heterogeneity. We talk about our differences, but then sometimes that is shamed. There's a lot of shaming that goes on. So I actually heard Mary Dougherty speak at NSAR about her experiences. She's an autistic person. She is an anesthesiologist in Australia, and she does a lot of training and speaking and talking about her experiences. And she talks about how sometimes she struggles to access language when she's burned out, or she talks about being out of spoons. So for her, she really feels that, and I don't want to speak for her, but what I've surmised in hearing her speak and reading her articles is that she sees this common thread. The burnout, the lack of language at times is quite similar to what it's like if you have level 3 autism and you're nonverbal. And so in her opinion, she would see those, anyone saying, oh, they're different. Those are different things.
Thank you. He's already given me kisses.
Oops, someone needs to mute, I think. So we have a lot. I say all that to say that's probably, bringing up some emotions for some people in the group, just, in different parts of the spectrum and how you feel. And so we spend a lot of time thinking about those things. They're valid differences. And I think there are things to be considered on all sides of this issue. Really, 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 really. But we cannot let that consume us. And so I say a lot of times in our meetings at Profound Autism Alliance and our advocacy meetings and our special interest groups, what we want to do is 10% venting, 90% doing. So right now we're going to pivot to the 90% doing and talk about like finally what we can do to help achieve health and connection for autistic adults. And pictured here are some autistic children and adults who were at our Profound Autism Summit a couple of years ago. So let's talk about health first. I think supporting the health of autistic people, and for me, it's very much through the lens of my experience with my son, Jack, who has the type of autism where, just as an example, he and I were in a hotel room a couple weeks ago. We went to Washington, D.C. It was his first time doing, well, not his first time. It had been a long time since he had done Hill visits with me. And I really believe in representation, authentic representation. So he was there with me. But we were in the hotel room early in the morning and a tragedy occurred. There was no coffee in the room. And so I thought, wow, I could just run down to the lobby and get a cup of coffee. But I couldn't. And the reason I couldn't is even though I would really want to, he deserves independence and he deserves not to have people hovering all over him. But Jack cannot be left alone because of sometimes he gets into dangerous situations very quickly that could be life-threatening. So I couldn't go get a cup of coffee. Now, yes, you can call and get housekeeping to bring, thank goodness. But that's just kind of an example of a difference where he just can't be left alone. And you know what? It sucks. And so when I talk about profound autism, that's what I mean. So that's my lens. And when we think about profound autism and health and all the things swirling around that, this is a quote from the Lancet Commission report from several years ago. And I agree with it. It talks about increased awareness in our community, but it hasn't really been accompanied by improvements in services to support autistic individuals and their families. And so, as many of you know, the Lancet said, okay, we're going to take the next 5 years, or we're going to identify things that could be accomplished in 5 years that we hope will make a difference. And so I like that momentum when you're thinking about what can we do, because awareness is not cutting it. What can we do? 10% venting, 90% doing. So talking about health and what we can do, one thing we can do with health is figure out what's going on with the health of people who fall into that profound category. And so many of those people are nonverbal or they have an intellectual disability. There are issues around communication that are extremely challenging. And over time, it's caused them to not be included in research. And when you think about research, there's lots of conversations going on about research right now on the federal level about how important it is, or people doing their own research. Research is critical if you're going to find solutions for people where they are to help them feel better, to help them live healthy lives, and be connected to the world around them. I was exposed really to this exclusion through my daughter, Amy, when she was an undergrad at Emory University. She was studying neuroscience, and she'd grown up with her brother, Jack. And Jack has had some really, really exceptionally horrific self-injury that we haven't been able to figure out completely. And it's changed him. It's damaged his health. And in our profound community, that's not uncommon. It's something that we see a lot, and there's just not much research around it. Amy was doing research at Emory with the Department of Anesthesiology at the Children's Hospital of Atlanta, and then with the Emory Autism Center. And it was about how autistic people experience pain. She was trying to figure it out, like what's going on from a neuroscience perspective. And so when she was getting her IRB approval, and when she was beginning to work on recruiting people to be in the study, autistic people, that representation, which is so critical, she learned very, very quickly that people like her brother would not be included, could not be included, just because of the IRB requirements and the lab itself and the way the experiments were designed. They just were not designed for people who are needing high levels of support at all times. So it was eye-opening, and she went forward, of course, with her research because she cares about all parts of the spectrum. But it was eye-opening for her and for me too. And subsequently, when we went to INSAR and we kind of talked to researchers and talked with other members of the community and learned, that over time, this population has kind of fallen to the wayside when it comes to research. And when you think about that, if your part of the population is not included in research, it's going to be very difficult to make progress for your part of the population. Not impossible, but it's going to be hard. I equate it to the whole menopause conversation that's going on right now. Women have been left out of research. That whole subject matter has been left out of research. And finally, people are saying, like, wait a minute, we need to focus on this group around this particular issue. And so that's part of the reason we say at Profound Autism Alliance, we really want to try to figure out how to include people with profound autism in research. Back in 1990, 95% of studies included profound autism. Fast forward to 2010 to 2013, 35% did. I'll kind of move forward because I have way too many slides. Another study, the Russell study from 2019, looked at 301 studies with 100,000 people with autism, published in 2016, and only 6% had intellectual disability. So what that means more than likely is that they just didn't include people with profound autism. Looking at the US National Database of Autism Research, there were around 50,000 participants back in 2012, but only 11% had IQ below 85. So were the participants that were in those studies not important? Of course not. Like, what they need, their inclusion is critical, but we're not going to have answers specific to the profound autism, the health of the profound autism population without inclusion. Another recent example, there was a meta-analysis done that looked at early intervention services and interventions for young autistic children. And they were saying, you know what, maybe less is more. We've had for many years people saying, oh my goodness, you need 40 hours a week of early intervention, and you can overcome your diagnosis and all these things. That was the talking point. And they were making the point, like, you know what, it's all about trying to help this person be the best they can be. And it's hard for young children to participate in such heavy duty sorts of scheduling and things like that. So it's understandable, and also too, from a business model perspective, it's less expensive, quite honestly, to provide fewer hours. And I think it's always important to acknowledge that that's a consideration that, it's probably floating around in there somewhere. So they came out with research that said, you know what, you don't need that many hours. You can do like 10 hours a week, and that does just as much. But the devil is in the details. So Tom Fraser, who's a member of our medical and scientific advisory board at Profound Autism Alliance, he wrote a letter to JAMA where this was published, and he said, Although the authors conducted comprehensive and thoughtful analysis, the primary study conclusion is heavily influenced by a serious selective sampling problem, which was not properly evaluated. So the shorthand for that is they didn't include people with profound autism. So if you have someone who has 24/7 lifetime care support needs, and you don't include them in research around dosage for treatment, those answers are going to be upside down. So the truth is going to set us all free. Some people require different levels of intervention. Some people require more. Some people are really into, deep pressure, and other people are very sensitive to pressure. The same thing goes for noise and lights. We're individuals. Our community is filled with individuals. Some of these individuals have similarities that create cohorts. And when those cohorts exist and they have needs that need to be met, it's appropriate to include them in research that addresses that respectfully, and using evidence-based practices so that we can really help them. That's what it's all about. So one thing we've done at Profound Autism Alliance, when I talk about 10% venting, 90% doing, out of the chute, we said, you know what? We feel like when we're in these crises with our loved ones with profound autism, the physicians themselves are at a loss as to what to do. And so many people are experiencing boarding in emergency rooms. Families have nowhere to go. There's just a chasm. And there's a few places across the country that will do inpatient care for people who are really in heavy duty crisis when they have these intense behaviors, but not many. So we funded a program at Profound Autism Alliance to train psychiatrists, neurologists, and other prescribing physicians who have relevant expertise in how to use best practice to help people in their communities, no matter where they are, no matter if they're in North Dakota or North LA. Like, it shouldn't matter. People should have access to care when they're in crisis, just kind of a bottom minimum requirement. It's been an amazing group of people leading this effort over the last couple of years. Matt Siegel, who's on our medical and scientific advisory board too, is a psychiatrist who is leading it. And we have a speech and language pathologist, Martine Lamy out of Cincinnati Children's, another psychiatrist. We have a BCBA, and then some people with lived experience who are helping lead this. And so far, we've had almost 200 physicians that have participated in these trainings with a total of attendance of over 1,300. And in 95% of these sessions that we've had, we meet twice a month. We've included a case presentation. So the case is usually someone with profound autism who's in crisis, and the psychiatrist, neurologist, or treating physician will present the case to the other physicians. All the information is redacted that would identify them, so there's protection there. And then they troubleshoot. They talk about how to help these people in meaningful ways. And it's not through just the prescription of drugs or hospitalization, but it's talking about how to support them in their homes to keep them safe and healthy, how to support their families, their siblings, who are just frazzled and stressed just like they are. So it's been phenomenal. I've been able to listen to these sessions. They're going to continue, but nationwide, these are the states where we've had physicians attending from. We got to get over here in the West and the middle a little bit, but in our first year, it's been incredible to see the response. People need this information and they can take it back home and change the lives of people in their community. Another thing that we're doing is working on a research definition for profound autism. Now, I didn't say we're working on a new diagnostic term for autism. We're not changing the DSM right now. We're simply just trying to create some clarity about how you include people with profound autism in research. Like, what does that mean? We talked before about how people with level 1 autism will talk about their high support needs, right? So are they to be included in research for people with profound autism? What would that look like? We need clarity on that for all involved. So we joined up with the Autism Science Foundation, and we did this thing. You guys are probably familiar with the Delphi process, where you reach consensus around something, around statements. So we put that out, and we had more than 100 experts weigh in. I would say that this research needs more global participation. It was heavily United States represented, so we need to get more global representation in this. But what we have so far is this definition. It's a research definition for profound autism. And that is for researchers like you who might be here to use in your research. I remember walking around INSAR a few years ago where they had poster session for profound autism. And I talked to most of the people presenting, and I got different answers at every poster about who were including as profound autism in their research. And their intentions were really good. I was really more interested to see who it was, but there was no consistency. So hopefully something like this will help. So of course the person has to have ASD. It was agreed that they should be at least 8. Although sometimes things might present prior to that. By 8, they felt like you should be able to clearly see if someone meets the requirements. And this is the kind of the drum I've been beating the whole time. They require adult supervision exceeding age-appropriate levels to ensure physical and mental health, safety, and well-being due to risks such as elopement, injury, or lack of environmental awareness. And I say these things, again, not in a way that's meant to shame these people. I've always used these personal examples, forgive me, but for my son, Jack, I would love for him to be able to drive to Logan Airport, stand in line in his flip-flops and a really bad Hawaiian shirt, go get on an airplane, go to an island, party all weekend, fly back home, like live his life the way he wants, and me be really annoyed at him for being irresponsible. Like that would be awesome. Like he deserves that. I don't want to keep him under my wing. You know, that is not my goal. I want to give him as much health and connection as possible. The reality right now for him is that's not the case. He, definitely is prone to running into traffic. He's prone to having a seizure. He's prone to choking because when he wants to eat, he wants to get done really fast. And so those things are things where he requires a high level of support, and we want him to live and be happy and connected, so we provide it. And that ties into the next criteria, which is demonstrates adaptive functioning skills significantly below age level and with an inability to independently perform such activities, most activities of daily living, like bathing, food, prep, and dressing, things like that. And again, no shame attached to that. That's just a reality. That's their reality. Doesn't make them less than, doesn't make them a burden. It's just the reality. And then it could be IQ under 50 and or limited verbal communication, not more than like single words. So I would say, like with Jack, his longest phrase is one directed at me, which is go away, which I hear frequently. So you kind of get the picture of who this is meant to represent. And this is just for research. These characteristics are neither intermittent nor transient. So some people say like, oh, I don't like the term profound autism, like it's too stigmatizing. I've heard that. So I'm like, okay, this is non-transient high support needs then. Like I'm willing to say like, what do you want to call this? Like, but let's just be clear about what it is from a research perspective so we can get some answers for this. So this was presented at a panel in SAR, and hopefully you'll be seeing it published soon in a journal. And that can inform research for clinical practice, in healthcare, in education, in all the ways, home and community-based services that affect our population. All right, got to keep rocking and rolling. Time flies. Let's talk about connection a little bit, and then we'll take some time. I'd love to hear what you guys are thinking about some of the things I've shared, and questions and suggestions you might have. So connection, we're going to talk about connection for caregivers. These are some amazing caregivers in this first picture that were at our Profound Autism Summit. I've connected with them through the years. I've connected with most of these folks through advocacy and just shared lived experience. This particular group presented on a really uplifting topic at the summit. I don't know if any of you were there, but it was one that I thought was so powerful. It was called the 3Ds: divorce, death, disease. Those are things that connect us, but those are things that we experience in the Profound Autism community. So in that session, we had Colleen, who's standing right here. Her son Matthew died in his sleep. He had profound autism. Sabrina, her son, had profound autism, and he had cancer and passed away. So there was death in their world, and they talked about how to deal with that. Lou in the middle had gone through a tricky divorce, as did Mara standing next to him. And then Kathy Martinez sitting on the very end. She had cancer herself as a caregiver for someone with profound autism. So that connection and hearing from others who'd been through these things, and realizing, we're not alone in these things, I think is so important to acknowledge for caregivers and for the autistic people in our community. Connection to, for me, forgive me, but I always think about connection as advocacy. Like we connect to solutions, we connect to legislators, we connect with each other by working to affect change. So I mentioned Jack was in the hotel room with me a couple of weeks ago. Well, he went to Washington. We did Hill visits, and we actually met with Elizabeth Warren, who asked to take a picture with Jack. We did not ask to take a picture with her. So how cool is that? So Jack is really connecting in his autistic self-advocacy. Why does that connection matter? Why do we talk about health and connection? And well, people across the spectrum, I know, feel excluded. Here are some specifics within our community. And this was a survey we did last year, and we're going to do it again this year. And the responses were like 432. So small survey, but it was informative, I think. So when we're talking about people with profound autism with our National Caregiver Survey, 63% had been asked to leave a program because of their behavior. It could be, meltdowns. It could be disrobing. It could be things like that, vocal, like screaming, things like that. 69% had been denied access to services such as healthcare, respite, school, etc., because of their high support needs. Many in our community just can't have access to programs because of their profiles. And I will say we're kind of living that right now. Jack graduated last month, and right now he does not have a placement. He's turned 22. And there's only really a couple of programs in our state that will serve someone who has severe self-injury, who has limited language, who needs assistance like he does. So we're waiting for staff and a placement and hoping that that will happen. So we're living this reality right now. And I will say, like, I'm witnessing him suffer because of it. Anyway, 80% have been denied the opportunity to participate in community programs, church, recreational activities, etc., because of their high support needs. Jack was kicked out of his Baptist preschool way back in the day. And they told me, they said, he just doesn't belong here. And it was terrible to hear. And I know across the spectrum, we experience those things, but within our community, you'll hear stories. Like Jack was not allowed to participate in Special Olympics because of his profile. Like when you're denied inclusion in disability sorts of situations or programs, I feel like that's just an all-time low, something that we need to change. Providers who want to provide care had similar concerns, and they talked about barriers. We asked them about that. And we asked, why won't you provide services to this group? 41% said it's safety for the staff and for the person that they're serving. Reimbursement, of course, is an issue. Lack of expertise, and then staff recruitment, which it's very hard to get staff involved when they can go work at Amazon for $20 an hour. So that's a huge issue that we're advocating around. So I've been advocating a long time. This was Jack actually on his first Hill visit. He was just a little nugget, and I was way, way, way younger. And then here he is now, like he's grown a little bit, and I'm old. But anyway, we were back on the Hill back in 2006 when the original Autism CARES Act was introduced. And in Texas, where I lived, there was a big fight. Joe Barton was the congressman who was blocking the bill in Congress, and he was from Texas. So that was like my first foray into advocacy. The bill did pass, and here we are 20 years later, still working on issues around that. So with the ability to connect, we created a network of advocates focusing on profound autism advocacy. We meet monthly, and we focus on federal advocacy, and we have state groups too. We also have subject matter groups around housing, safety, and I love the name of this one, Meaningful Days for people with profound autism, whether it's in their community, at home, like whatever. How are they spending their day? How do they want to spend their day? And this is our representation in the Profound Autism Advocacy Network. It's been incredible to see people just jump in and engage in positive advocacy, but Wyoming has been, not active. I go to Washington on most Wednesdays. This is a picture of me pulling out of my driveway a few Wednesdays ago. What is today? No, today is Monday, but I'm not going this Wednesday because of the shutdown and some issues around that. But most Wednesdays I fly there and back from Boston just to meet with legislators and talk about profound autism with them, and then also with other community members. I mean, I've talked with people from ASAN, I've talked to people from Autism Society and Autism Speaks and all the groups, because I think if we're talking to each other, we can really get somewhere. So positive advocacy on these Washington Wednesdays. And I've had lots of people come with me too. And we just are focusing on meeting all members of Congress because they don't know what's what, and I think people have the impression that they kind of absorb what's happening online. They don't. They don't. When we go talk to them about things, a lot of them have no idea what's going on in the autism world. And so we're there to tell them, here's the handout that we used, where we talked about how 1 in 4 autistic people, according to that CDC study, have profound autism, but less than 6% of the research studies included people like them. And so we talked to them about just the need to make sure everyone's included. And it's been amazing. Like, here's an example of a schedule I had one day where we're just meeting with all the different senators. It's tiring. I'm too old for this. And I have moved from wearing heels to just tennis shoes with my dresses now, and I'm glad that's in fashion. But we got language in Autism CARES, which has been incredible. Here's the language that we got in last year. And it said the research that's funded has to include the entire population of individuals with autism spectrum disorder, including those with co-occurring conditions and the full range of support needs for supports and services, which I think is so, so, so important. And President Biden signed it. And you can see in some of these pictures, some of the people who were walking the halls advocating. And if you're ever interested in going to a Washington Wednesday with me, I would love for you to. Like in this picture, you have some researchers that are with me. We have siblings, parents, self-advocates, all sorts of people just walking the walk, talking the talk on Capitol Hill, which is so important. Moving forward, most recently, they're talking about how they're going to fund the government. You guys know it's shut down right now, but the language right now that's in the Senate and the House appropriations reports again reiterates the importance of including those with profound autism in research. And again, it doesn't say exclude others, but it just says, hey, make sure you include those with profound autism. We recently were in a meeting with the director of the National Institutes of Health, Jay Bhattacharya, and other members of the autism community. So it was Profound Autism Alliance, and of course, ASAN, Autism Speaks, all the other groups were there meeting with him. And he talked about the 13 research studies that they're going to fund through the NIH. And some of those, they were introduced or released just a few weeks ago. They're online, you can look at them, but profound autism is definitely a part. I was reading yesterday, there's a study from UCSF that's one of the 13 grantees that's looking at profound autism. So it's very exciting already to see the change. These are some of our siblings. They have had 2 Sibling Hill days. And they're incredible advocates. Their experiences really matter. Not all siblings are the same. Some have really, difficult experiences with their siblings, and some don't. Some people are driven into advocacy or service. Others are driven away because they need to protect their own mental health. These are realities that we want to recognize and support. Last year, we decided to recognize Profound Autism Day in the States just so people could understand what we're talking about. And then when we're asking them to fund things, to do research, to fund services that need to be provided, they would know what we're talking about. So we took that research definition, put it in a proclamation, and we got it in 15 states, which is really amazing for the first year. So we're going to be doing that again. Our siblings meet monthly, and they have several projects that they're working on. They support each other. And one thing that they do that I love, we have siblings who are PhD level researchers. Some of you are probably, in this webinar right now. And so they're helping to connect the families who reach out to us, who want to be included in research, with researchers that are relevant to them. So it's kind of like Match.com for research within the profound autism space. So if you want to be included in research, or if you're a researcher who wants to connect with profound autism families, you can go to our website, and I'll send the links around. But our siblings are the ones who are making this happen, and I love what they're doing with that. Connection, our caregivers have an online private support group. And then we also have a place where stories can be shared. This is so important to me. A lot of people pour out a lot of information about their loved ones. I've done this too. And then over time, they're getting older. They deserve privacy. They deserve dignity. They're not inhuman. These are human people. But we do want to share the stories in ways so people can understand us. So our Dignity Project is a place where you can do that. Stories and pictures can be uploaded on our website if you're interested in that. And finally, I think the ultimate way to connect is through our Profound Autism Summit. We're going into our third one this year. The first year, we didn't know if anyone would come, and we had 550 people from 34 states, which was incredible. And I think it talks about just that need for connection within our community. And I'd say too, within our community, kind of veering back to what I'm supposed to be talking about here, which is serving autistic adults. Within our community, the vast majority of caregivers and siblings who are coming to these things are those that are connected to adults who fall into that profound autism category, and the providers who are trying to serve them. And I called this like our first sort of group hug for this community. Everybody feels so alone and isolated. So it felt really good. Some of you were there. Last year, we were just floored that we had 1,000 attendees from 33 states. There was no anger. There was no shaming. This was just all about sharing information with people who need to learn and grow to help support autistic people who require lifetime 24/7 care. So we're going to have more of that moving forward. April 16th and 17th in Boston. Again, there's a virtual option if you can't get there in person. We are going to be offering scholarships for families who cannot afford to attend because we don't want it to be cost prohibitive. There will be ways to access the content. So go to profoundautismsummit.org, and join the mailing list so you know. Like right now, registration has opened. It's early, but come, like it's so good. Like if you look at some of the things that are offered here, this sibling panel that we had last year was incredible. It was moderated by an amazing sibling and self-advocate, and the perspectives were amazing. We had healthcare information that really included topics relevant to our community. You can see like sex, sleep, siblings, advocacy, PICA, toileting, all the things. And then all this information, we continue to discuss it at Profound Village afterwards. So there's a place for health, there's a place for connection, there's a place for those who really want to support and empower people with profound autism and those who love them. So with that, I will take a breath and answer any questions, consider any criticisms, take your suggestions. I hope this has been helpful.
Thank you so much, Judith. We have only 6 minutes left, so I just want to, those who will watch this on demand, I want to go ahead and acknowledge some of the comments that were made. I wish we had another hour, and maybe we can, because the good news in the embarrassing introduction, I didn't read because I know Judith too well because she's too humble. She is one of the fiercest advocates I've ever met, and the reason I think we connected, I guess, in 2021 at a conference where I knew no one, and she was so kind to me, and I had no idea who she was, and she brought me into her community. The reason I was at that conference was because I grew up with a woman who had autism, with autistic disorder with profound intellectual disabilities, who was one of my mom's best friend's sisters, right? Or sorry, my mom's best friend's daughters, who she was the oldest. Her name's Ellen. She's still living in a beautiful residential facility, and her mom has dementia now, right? Otherwise, I would have invited her to hear this today. So I think we need to acknowledge as a community that a lot of folks go into this field, like Judith just mentioned, her soon-to-be physician daughter. are helpers because of the people they grew up around that they know need help and support. And some of us who are clinicians in this field are feeling attacked because of words. And words do matter. And so many of you saw me, maybe I see some of the names on the who have attended, heard me say on the stage in Dublin last month at the Europe Congress, we need to talk to the individual in front of us, right? And you can bring your lived experience to the table, but the compassion and clarity with which Judith just delivered is why we are so excited you did that. So now I'll go to the comments, and most of them, I'm just going to read them quickly to honor the people who are brave enough to put things in. So those of you watching on demand can see someone said, just for the record, I have Asperger's syndrome. You can use Asperger's syndrome, and those of us with Asperger's syndrome prefer that it is used out of respect to families whose lives are affected by profound autism. Thank you. And my response was, and this is what I say in all the trainings I do in autism assessment around the world. Absolutely. Thank you for making this point. I have family members who received diagnoses in the 70s when words were very different. That's why we want to talk about this in a respectful manner. And so thanks for sharing your perspective. Someone else said, fabulous points, Judith, particularly the quote threatening part. We have come into this field decades ago and recently advocating for profound versus, no offense, high functioning, knowledgeable parents versus newly minted professionals versus young parents, and on and on. We need to recognize the skills and knowledge of others. Everyone brings the gifts to the table. Be open and kind. That includes divisive environments of politics. We can go further if we work together and find common ground. Amen is my reflection. I want to get through the rest of the comments to be respectful. Will you be sharing the slides, or should I be taking better notes? Thanks. And thank you to Dr. Palizzi who said we will be sharing the recording of the seminar. Those of you who joined us late, we apologize that we rescheduled this on a federal holiday, and we're so grateful those of you who showed up. So thank you for that. Someone else said to maximize the participation from individuals with profound autism in research, I believe study design should increasingly leverage remote data collection methods, gathering information from participants' homes, schools, and communities. So families don't need to travel to clinics to participate. Absolutely. And look at our AJ Drexel Autism Institute website or email me because I'm doing one of those studies now. I just want to acknowledge if you have a profound autism or are autistic yourself or are caring for an autistic family member and you don't meet inclusion criteria for the study, it's those of us who are intentionally trying to do studies and that have something called a minimal verbal mental age or otherwise, it's because the intervention might not be appropriate or help your family if you're excluded, which has happened for some of my studies and it hurts me, but it's not good for the family to include them. So we can talk more about that maybe in another seminar. Then this is one of my favorite comments. Judith, you probably didn't even get to read yet. Jack is a good-looking young man, exclamation. Somebody else said cultural and linguistic differences are important to consider. Such a good point as well. Another person asked, when will you say siblings, quote, do you mean other autistic people? And Dr. Vivanti, who's a co-chair of this seminar with us, answered, siblings can be autistic or non-autistic, brothers and sisters. And the person responded, oh, you mean literal siblings. Got it. Smiley face. So thank you for that kindness. How to attend the summit online, let me know. So Judith, in the interest of time, they should look at the website that's posted here, right?
Yes.
Okay.
Yeah. Or just go to profoundautismsummit.org.
Okay. Well, the summit, sorry, go ahead, Judith.
Okay, just email info@profoundautism.org and we will direct you accordingly too.
Okay. And as you can tell, I'm a deeply feeling human like Judith, and I respect everyone's time. So I see it's 1:00. If you need to hop off, this will be recorded. I just want to finish reading the rest of the comments to honor everyone who was brave enough and kind enough to be so respectful with your comments. Will the summit be recorded for people who can't attend? Yes, Judith answered that. And someone said, please. Someone said, thank you. All sounds great. Maybe add to the definition of profound issues with behaviors, SIBs, PD, and aggression. And there's been some thumbs up to that comment. Others are saying, thanks for this presentation, amazing presentation. Thank you, Judith, for your tireless advocacy and your compassion. And it'll embarrass you, so you can go read it yourself, Judith. You want me to read it all? It's up to you. I'm happy
No,
to.
I
Okay.
would say this is not about me at all. Like I said at the beginning, life's a chess game and I don't know how to play chess, but I hope you all will join in the chess game with me, hopefully in some of these areas. If it, you know, resonates with you at all, I really think this is a new era. We can change things. We can work together. We can move forward. It's okay to be clear about serving certain populations at certain times. That's okay. That doesn't mean it has to be a threat to someone else. So let's move forward and support each other.
Yeah, that's what I'm currently in right now at that age because I'm 31, because it's a much different part. Because in the South, even the black folks get it, but the problem with the family, they try to do the traditional style. It's like, look how slow they are to adjust.
Mm-hmm. Mm-hmm.
So that's a bit of our own fault before you even notice this problem.
Right.
Absolutely. Yeah. Thank you for that comment. And I should have said,
Yeah, and that
in the
explains why HBCUs they trying to do autism, but the issue they don't have the required skill enough, at least in that culture. Because look, how, especially if they grow up in the South, it's a big difference there.
It
it
is.
is.
I'm from Texas. My husband's from Georgia, so
Yeah, but
I
yeah,
feel
the difference, at least in Texas, is spread out. But Georgia is done. It's Atlanta all in one part.
yeah.
Basically,
Thank
on
you.
demand, not enough personnel to do it.
Right. Well, that's part of the reason we did ECHO, where we do things trainings online. So people come in from all over. So we're going to
Yeah,
continue.
because Atlanta's a booming part. It just doesn't have the supply to keep up with it.
Right.
Thank you so much for that comment, Jordan. I can say I actually did all of my training in the Southeast, including in Atlanta, and I completely agree with you. And I want to make sure, in the interest of time, to hand it over. And Jordan, please, or Mr. Dotson, I should say, please do check out our AJ Drexel Autism Institute website, because I think there's some studies and or opportunities for exactly all the things you were just talking about that are really mission aligned and important to us and to Bancroft, who are co-sponsoring this series. So in the interest of time, I want to hand the microphone back to the wonderful Dr. Palizzi, who is our shared postdoc at the Autism Institute and Bancroft, who created the seminar series. And you can see many folks, there's lots of different faces on this slide that was very intentional. We wanted it not to be an echo chamber series. We want there to be many different perspectives represented. And you'll see the final one. I'm with my colleague from Nigeria talking about culturally centered autism assessment, which is one of my passions. So, Dr. Paolizzi, take it away.
Thank you, everyone, for participating, and thank you, Judith, for your time and sharing your experience and your knowledge. Um, we will have a seminar next week and upcoming months. We are going to have a seminar each month, and there will be also Mary Doherty that you decided before. So we are really excited to see all our upcoming guests. And if you want to learn more or have questions, feedbacks, feel free to email me or Claire McGrath at ep637@drexel.edu or claire.mcgrath@bancroft.org. You can find the recording of our seminars on YouTube. And I'm going to leave you here the QR code for our current study that you can join. It's an opportunity to participate in the Express study, and they're looking for caregivers of autistic individuals age 80 years or and older that are non-speaking or minimally speaking. Thank you all for participating, and again, thank you, Judith, for being with us.
Thank you so much. And I will send you those slides.
Thank you so much.
Fantastic. Thank you. And just in the recording, it's 8 years old. That Italian accent sounded a little bit like 80, but it's
Oh,
8.
sorry.
But that's okay. Don't No apologies. This is culturally, remember, that's one of my big themes and loves. So 8 or older. So thank you so much, everybody, for showing up and staying till 1:05 even. And we are going to go ahead and close the Zoom room in just a moment. So thanks again. I want to give Judith a chance to read the lovely things in the chat before we close out the Zoom room, because I see ciao from Italy. So thanks for joining us from Italy too. autism in catatonia, we can absolutely, I think we can reach out to the Autism Institute, and Dr. Vivanti, I think, might still be on. We've got a lot of good things going that we're happy to share information about.
Yeah, and absolutely feel free to email me with all the additional question, and I will be taking care of redirecting them to the people that might have like the best answers for you.
Yeah, absolutely.
Yeah, because there's a budding interest. Actually, if you're still on, whoever just asked about autism and catatonia, since I've been to both of the Profound Autism Summits myself, there were great talks about that by some of the premier physicians in the country, working with people that I love, actually, who are having autism and catatonia. So you should, Judith, will those speakers be featured again in next April?
Yes,
Okay.
we're gonna have a catatonia breakout, and we're also gonna have a self-injury breakout. But yeah, catatonia is a huge topic of interest. It affects so many in our population. So yeah, definitely email at info@profoundautism.org with any of these questions, Molly, Linda, others, and I'll get back to you and kind of direct you because I feel you. We can help you get involved with um, researchers. We can talk about catatonia. I can connect with others. So health and connection, that's what it's all about.
Health and connection is all it's about. And someone just asked, can I call you at Drexel? I would say, Dr. Polizzi, can you just read off the email, put it in the chat for different types of learners but put it in the chat that where they should email to learn more about some of the things we've just shared.
I just sent the email for the Express study.
But for people who have questions about today or who just want to talk to us about autism, this series, what's the email? Is it your email address?
I'm gonna write it in the chat.
Perfect. All right. Oh, I see that. So I'll read that while you're doing that. So if you're interested in the Express study we just talked about, that email is express, EXPRESS underscore study at drexel.edu. And then Eleonora's putting in the best channel to reach out because she knows how to find me. She sits next to me and can get to me if someone wants to talk to me specifically or Dr. Vivanti. So for additional info in the seminar series, the email that you should use or anything related to what I mentioned of the work we're doing at Drexel or Bancroft, Eleonora, our Dr. Polizzi, our postdoctoral fellow, her email is E as in Edward, P as in Paul, the number 637 at drexel.edu. And before we close out the recording, I do just want to acknowledge one thing I meant to say in the beginning. Some of the stories that Judith just shared are really hard to hear, right? Because autism, I have someone on the spectrum who I say he's a person with autism because he's 14 and that's what he wants to be called. And then I have another autistic person who's older who loves to be called autistic. So I always ask those people specifically what they want to be called when I meet them as a clinician, researcher, or a human. And I just want to close by saying I remember where I was the day that that young man and his mom passed away in the fire. And it broke my heart. So if you saw him, I'm a deeply feeling human like Dr. Polizzi and Judith and others that were on camera. So if you saw us either smiling and laughing, some people use humor to cope, some people cry, and I just want to acknowledge that all of that's valid and thank everybody for coming. And I think we are all done. So thanks everybody and have a wonderful rest of your federal holiday. And thank you for joining us today so much.